Unlike a lot of other body parts that we have, it is one of the only organs that continues to grow throughout a male individual's lifespan. Hey YouTube fam, it is Dr. Fenwa Milhouse, board certified urologist, co-CEO and co-founder of Down There Urology. I have treated countless individuals, countless men with enlarged prostates. And I want to talk about proactive management that can make all the difference, potentially helping you avoid surgery down the line altogether. In this video, I'll walk you through the treatments that work, the ones that no one talks about enough, and how to know which is right for you or someone you love that has a prostate. Let's start with the basics. BPH stands for benign prostatic hyperplasia, which is just a fancy doctor term for an enlarged prostate. The prostate is an organ in the male reproductive system that contributes to the semen. It helps produce part of the semen and is important for normal reproductive male health. It's a walnut-sized gland that sits behind the bladder and in front of the rectum, and it's important for male reproductive health. It produces a significant part of the semen, and it helps to create an environment that is healthy for sperm to be able to penetrate and fertilize the ovum. Unlike a lot of other body parts that we have, it is one of the only organs that continues to grow throughout a male individual's lifespan. A lot of other body parts stop growing after a while, organs stop growing, but the prostate is exceptional in that it can continue to grow for the rest of a person's life. And that growth isn't necessarily cancer. There's prostate cancer and then there's BPH, benign, aka not cancer, prostatic hyperplasia or prostatic growth. So it's not cancer, it doesn't spread, but it does grow over time, and usually starting around the 4th or 5th decade of life, 40s and 50s. This growth squeezes the urethra, the tube you pee through, and that's where the trouble starts. As it's squeezing through the urethra, the bladder is unable to empty as usual. The flow decreases, and that flow decreasing and the bladder not emptying can subsequently lead to more significant problems, including bladder stones, complete urinary retention, recurrent bladder infections or UTIs, and even kidney failure. So some of the first symptoms are so subtle, most individuals may just brush them off. Early symptoms include weak flow or dribbling or interrupted starting and stopping stream, trouble or hesitancy starting the stream, like you gotta rev the engine up, and that never quite empty feeling, like you went, but it doesn't feel like you got most of it out. Or getting up more often at night might be an early sign. Usually BPH starts again around the age of 40 and 50, and up to 40% of men older than 50 have symptoms. But here's the thing. For a lot of individuals, these early symptoms may be their window for opportunity. Today's era of effective medications, lifestyle strategies, only a small percentage of men with BPH, benign prostatic hyperplasia, actually end up needing surgery. Most are managed successfully with medications, behavioral changes, or minimally invasive interventions. Surgery, typical prostate surgery, is reserved for specific cases where men don't respond to other treatments, or if they develop complications like urinary retention, inability to pee, bladder stones, or kidney failure. In fact, the American Urological Association supports this approach of trying medications, behavioral techniques before proceeding to more invasive options. Real world data back this up as well. Only about 1 to 2.4% of men with BPH undergo surgery in routine clinical practice. And that rate tends to rise with age and the severity of symptoms, which makes perfect sense. However, it is important to note that longer-term studies, especially those following men with even mild symptoms, the chance of needing surgery over time can be higher. For example, one review published in the Journal of the American Medical Association, JAMA, found that over a 6-year period, a higher percentage of men eventually progressed to surgery, even if they started off with mild symptoms, up to 15% in this group. When you ignore bothersome urinary symptoms for years and years and years, either because you think it's normal aging or you're too embarrassed to bring it up, you may give the prostate time to get so big it becomes more problematic. More serious problems associated with BPH that may occur later on include, again, the inability to urinate, where you just, like, the valve completely shuts off. You can't pee at all. Retaining so much urine in your bladder that it backs up into your kidneys. This is a real thing. It can affect your kidneys, allowing them to swell, and that actually affects how they work, lowering the kidney function. You can develop bladder stones from stagnant retained urine in the bladder that's not being able to get emptied, or you can be prone to recurrent or frequent bladder infections because of the retained urine. In these scenarios, surgery often becomes the only real option. So let's break down the non-surgical approach to BPH symptoms. Medications like alpha blockers. These are medications that relax the muscles in the prostate and around the bladder neck. This can help alleviate the symptoms of BPH and improve bladder emptying. Medications like tamsulosin, aka Flomax, or alfuzosin, aka Uroxetrol. Even tadalafil, aka Cialis, has been shown to help relax the smooth muscle around the prostate and the bladder neck, and taken on a low dose daily basis can be used to help alleviate BPH symptoms. A different type of medication called 5-alpha reductase inhibitors, like finasteride, and you might recognize finasteride as a treatment for alopecia. In the lowest dose, finasteride can be used to treat androgenic or testosterone-induced hair loss, but in the higher dose, typically 5 milligrams, finasteride or 5-alpha reductase inhibitors work by slowly shrinking the prostate over time. These medications take months and will not immediately change symptoms, but over time can affect change and treat BPH symptoms. Sometimes we combine both the power of a alpha blocker and a 5-alpha reductase inhibitor and do a combination of something like tamsulosin and finasteride together. We may also recommend lifestyle changes, cutting out bladder irritants that are gonna make you go more frequently, like coffee, tea, soda, alcohol. We may recommend you go on timed voiding, where you pee at certain intervals every 3 or 4 hours, just to try to get the bladder more empty. And we may even send you to pelvic floor therapy. Yes, men have pelvic floor muscles as well, and pelvic floor physical therapists may help to address some of these symptoms. Now, there are minimally invasive procedures, and though technically these are surgeries, these procedures were invented to try to minimize the invasiveness and side effects of the more traditional prostate surgeries. They typically involve some sort of lifting, vaporizing, or other ablative therapy of the prostate tissue. Some of these procedures can even be done in the office and not necessarily have to go to the operating room. If you're having symptoms, here's what you can do right now. Track your urination patterns. Put it in writing, okay? Do a bladder diary. I know, yeah, like a diary that maybe you used to do in junior high. Do a bladder diary. You can do this through different apps on your phone. There are voiding or bladder diary apps that you can download to your phone at the tip of your fingers. I oftentimes will utilize an app called IU Flow. By the way, they're not paying me to say this. I like this app because it's simple to use. With the IU Flow app, you can easily track when you pee, how much you pee, what you drink, how much you drink, and you can even take notes about how you pee. How urgent is it? How slow is it? That sort of stuff. But you can track your urination patterns. This can be very helpful when you come in to see us and present your symptoms, and you have some objective data to back it up. When you do this tracking, you want to track for a full 24 hours, okay? That includes when you're sleeping, all right? So you want to make sure you're tracking those urinations as well. And typically you want a minimum of 3 days to kind of see your typical patterns. Talk to your doctor about any bothersome symptoms, okay? Don't be embarrassed, all right? These problems are very, very common. Like I said, 40% of men 50 and up have these issues. So don't be afraid to bring it up. Don't be afraid to ask about other options. Don't be afraid to ask to get referred to a urologist or find a urologist. And always educate yourself on this matter. With the advent of good sources of medical education, i.e. your favorite urologist right here, down the Urology YouTube, like this video, you can educate yourself in a meaningful way and enter the visit more informed to make the best choice for you. Now, there are certainly cases where surgery is the best option, especially if medications you've tried have not helped and you are still very bothered. Or if you've experienced a more serious problem secondary to BPH. Again, if you are having so much trouble urinating that you literally can't urinate, if you develop a bladder stone, if you've had issues with urine backing up into your kidneys, if you've had recurrent bladder infections that are due to retained urine, these are indicators that you probably need to have a surgical intervention. I want you to remember this. Don't ignore bothersome symptoms ever, okay? Ask about your options. It is not something that is a normal part of aging that you just have to put up with, all right? If you know someone who sounds like they have an enlarged prostate, taking them forever to empty, you hear the stream, it sounds pitiful, it's dribbling, they grunting, straining to urinate, they feel like they always got to go. Like if you have that type of person in your life, this sounds like them, share this video with them, okay? It could change everything. If this sounds like you, now you are empowered, okay? Your prostate does not have to take control of your life. So hit this like button if this helped you. Please subscribe for more real talk, real education from a board certified urologist who just keeps it plain, okay? And drop a comment with questions, all right? I want to hear your comment. What else do you want me to answer in the next video? And I will see you next time for all things down there right here.